My name is Joseph Preston. I'm the co-editor-in-chief of Brilliant Doctors Magazine and the co-host of Brilliant Doctors TV. I'm here in Washington, D.C. at our headquarters building, way above the Washington Monument and White House. Today we profile the American Dental Association National Convention here in Washington, D.C., where we meet some brilliant doctors and some true innovators in healthcare technology. Enjoy the show. I'm here with Dr. McCullum, and Dr. McCullum is a periodontist, and she's going to tell us a little bit about Millennium Periolase and LANAP and LAPIP.
Yes.
So, Dr. McCullum, tell me about how prevalent gum disease is in the U.S.
Oh, it's one of the most prevalent diseases in the United States. It's more prevalent than diabetes. It's more prevalent than hypertension.
Tell me about your practice.
I practice on the south side of Chicago, and I have a practice along with my husband, an oral surgeon, and a general dentist. So we treat a wide range of patients from mid-30s up to 90 plus.
Tell me about your personal story. How did you become a dentist? Why did you become a dentist?
Wow. How much time do you have? My dad was a dentist, so he never liked giving away money, so he had to work in the office. So I fell in love with dentistry watching my dad take care of his patients.
Tell me about the old style of cut and stitch.
Yes.
Versus the new wave, so to speak.
Okay, well, once upon a time, the only way to really get to the root of the problem, so to speak, was to make an incision, reflect the gum tissue back, so you could visualize the root and the bone. You would reshape the bone, or you would add growth factors or different bone materials to help the body regenerate. And once you did that, you would suture everything back together. And you would also trim away gum tissue. And those were the types of surgeries that I used to do pretty much all the time. Well, what's so special about it is it uses the body's own healing abilities to work in its own benefit. So you don't have to cut away the gum tissue, you don't have to reflect a big flap, you don't have to use outside materials like bone powder or growth factors. The patient doesn't have to go through any initial treatment. It likes untreated gum disease. So the patient treatment time is less. They don't have to go through initial phase and then surgical phase. Everything's done in one visit, maybe over 2 visits if you don't do a full mouth. So you get quicker results, and it can be less expensive because the patient really isn't spending as much time in the dental chair.
And what's the most important question a prospective patient should ask their doctor before, if they've been diagnosed with some form of periodontitis?
What are my options? Please explain to me all of my treatment options so they can make informed decisions. And I think every dentist should know about the LANAP protocol because it is a very good option that patients should be offered. Whether that dentist can provide that procedure or not, there are many dentists out here that are now owners of this Periolase and doing that LANAP protocol. So in my opinion, it's the standard of care because it's such a good way of treating periodontal disease.
Is there anything else consumers should know? Any other advice or thoughts that you would like to share with prospective patients?
With prospective patients, just know that there's a company out here that's fully dedicated to giving you state-of-the-art periodontal treatment, and they've developed this protocol just for you. It's just for treating gum disease, even though there's some other wonderful things they can do for you, but there's really some nice options out here for helping you save your teeth, helping you save your implants, improve your overall health, and just live a long life with your teeth where they belong.